Let's talk about endometrial cancer. It's a cancer most common in the postmenopausal females. Coming to the risk factors. The risk factors are increased level of estrogen state, which includes like early menarche, late menopause, nulliparity, infertility, use of tamoxifen-like drugs, which increase the risk. Other comorbidities like diabetes, hypertension, obesity, PCOS. These all are the risk factors. Coming to some genetic factors, which includes BRCA1, BRCA2, Cowden syndrome, which includes PTEN gene mutation. These are the risk factors. Coming to the protective factors. Protective factors includes breastfeeding, use of OCPs, physical activities. These all are the protective factors. Coming to the types, based on histopathological examination, we have divided it into type 1 and type 2. Type 1 is an endometrioid type, whereas type 2 is non-endometrioid type. Type 1 is estrogen dependent, it has a good prognosis, it has pre-invasive lesions present in it, whereas type 2 is estrogen independent, it has a bad prognosis, and type 1 is more common in obese females, whereas type 2 is more common in thin patients. In type 1, gene mutations are P10 KRAS gene mutation, whereas in type 2 you will find P53 gene mutation and you will find clear cells in it. Now coming to the symptoms, the patient presents with a complaint of irregular bleeding and postmenopausal bleeding. There can be some other causes of postmenopausal bleeding as well, like atrophic endometrium due to old age, atrophic vaginitis, cervical cancer, or polyp, which is the most common cause. Once the patient complains of post-menstrual bleeding, you will proceed with the transvaginal ultrasound. If on ultrasound you find the thickness greater than 4 mm or less than 4 mm, when it's less than 4 mm, you will most probably suspect it's a atrophic endometrium and the patient will have spot bleeding only. And if it's greater than 4 mm, then you will go for endometrial sampling. You will go for endometrial aspiration cytology or endometrial biopsy. After, and these two processes are the OPT procedures. If you are not getting sufficient results, we will go for OT based procedure, which is dilation and curettage with hysteroscopy to actually figure out what's there into it. And on endometrial biopsy, you can find whether it's endometrial cancer or it's endometrial hyperplasia. Endometrial hyperplasia can be of two types: hyperplasia with atypia, without atypia. There are many indications of endometrial sampling apart from this postmenopausal bleeding cause. There can be, if the female is less than 45 years old, presents with abnormal uterine bleeding with high in amount or increased frequency or prolonged duration. These, or she has risk factors for endometrial cancer like HNPCC, PC, genetic mutations, or she is obese, she has Lynch syndrome. These all are the indications when she should go for an endometrial sampling. Coming to the final part, the staging and treatment. Staging figure says it's a surgical staging. There are four stages: stage 1, 2, 3, 4. In stage 1, 1A is there when it's only the endometrial or it's invading the myometrium, but it's less than 50%. In 1B, it's invading the myometrium and it's greater than 50%. Stage 2 is when there is a cervical spread and it has also invaded the cervical stroma. Stage 3 is classified into further parts like 3A, 3B, 3C1, 3C2. 3A includes when the cancer has spread to the uterine serosa. 3B is when the cancer has spread to the vagina and the parametrium. 3C1 is when it is involving the pelvic lymph nodes. 3C2 is when it's involving the para-aortic lymph nodes. Coming to the stage 4A is when it's involving the bladder or rectum. 4B is when it's involving the distant metastasis, which are the inguinal group of lymph node. Coming to the treatment part, treatment is done according to the stage. If it's a stage 1, you will go for an extra simple extrafacial hysterectomy with bilateral salpingo-oophorectomy. It can be done through laparoscopic. For stage 2, you will do a type C hysterectomy, also known as radical hysterectomy, with pelvic lymphadenectomy plus bilateral salpingo-oophorectomy. In stage 3 and 4, you will do the debulking surgery, also known as cytoreductive surgery, where you will do the transabdominal hysterectomy plus bilateral salpingo-oophorectomy, and you will also remove whatever tumors you can remove. And if it's a metastasis case, along with it, you need to use some chemotherapy drugs also. Then coming to the post-op cases, in post-op, when it's a low risk, which includes type stage 1A, grade one or two tumor or endometrial tumor. No chemotherapy, no adjuvant therapy is required. When it's a high risk, means stage 3, 4 is involved, you will do a adjuvant therapy, which includes the drugs like carboplatin and paclitaxel. And if it's a metastasis, and if it's not responding, it's resistant to cytoretic drugs like carboplatin and paclitaxel, you will use a drug pembrolizumab, which is a immuno checkpoint inhibitor. So this was all about endometrial cancer, everything you need to know about it. Thank you so much for watching.